Yes, top of the moment to you. Anywhere where they watch us from, it feels great. It feels joyful to be here today. Talk of say, today Health Matta no be just the usual episode we would do, but this time around, now the one we carry celebration, join body as we dey give glory to Baba God wey keep us first year, second year, third year, fourth year of Health Matta. Some program don't come, they don't go. Some program will even begin with Health Matta. Some of them self, it don't go down the way. Among this one, God will keep us alive. God will give us the wisdom. God will give us the ingredients to sustain the show. He can't keep you too there to continue to watch the show, because if you know they there, waiting will they do. So therefore, so we'll say thank you, God. I will say thank you so very much to Dr. Barth, our host doctor.
Thank you.
Say a very big thank you.
Thank you
You've
very
been doing
much.
a wonderful job. God will continue to increase you,
Thank
your
you very
household,
much.
your hospital, and everything where you lay your hand upon. Not to also forget the fact that your feather has been added to your crown as the president of the Rotaract Club, and we wish your administration, your dispensation, a smooth sail.
Thank you very much.
Thank you very much,
Thank
sir.
you very much. Thank you very much.
Thank
I
you.
appreciate you.
Yeah.
This was a program we started some 4 years ago. And I would like to point out that I actually started this program with you. And
Veru.
no, it wasn't Vero. It was Omonla.
Omonla, yes. Omonla, yes.
Okay, so great guy wherever he may be at this time. Okay, but how time flies. And just like
And
that.
I have to make this joke too. I have to crack this joke. I remember your first episode. The doctor was highly tense, and he was like, "This is not my team. This is not hospital. But I will survive. I will cope." I
can still remember my very first topic. Yeah, my very first topic on this show was Ebola virus. That was when initially hit Nigeria. Ebola virus.
Doctor, now they get archive.
Yes, so 4 years ago, and we're happy to be back. And for our viewers who have stuck with us for all those years, we appreciate you. And I also like to appreciate the management of WAP TV for keeping us afloat since all those years. And we are grateful to God for keeping us alive. Very important. Okay?
Management, we thank you.
Thank you very much. Thank you also for pointing out that I'm now the changemaker president of Rotary Club of Ikeja South. Okay.
We saw dignitaries like Dele Momodu and every other person.
My induction was about 3 weeks ago.
Yes. It was aired on WAP TV Thursday.
Yes, on Thursday. Thank you very much, our viewers. Thank you so much.
Okay, we won't stop the appreciation there. We have to thank Grace Valley too for always sparing you for us. That's the hospital, Grace Valley Medical Center, where they allow Oga come do this every morning, because if they talk, say, doctor, we have emergency, you have to operate now, you are going nowhere, you no go there here. So we thank Grace Valley, because we know say then they watch too. Yes, they always watch WAP TV.
Grace Valley, my wonderful family, my wife, my children.
Mommy, we love you.
You guys have been tremendous.
You. Thank you, ma.
Yeah, thank you very much.
Yeah.
So it's celebration mode that has been activated.
And okay, with this our lovely cake.
Yes.
We go chop am. And viewers, I must let you know, this thing no be artificial, na real cake. So if you are very close to us,
cake, you can join us.
You can join us.
Thank you. So this morning we'll be looking at COVID-19 vaccine updates.
Yes.
That is the talk of town at the moment. COVID-19 vaccine updates.
Okay, Dr. Barth, let's do it this way. I will allow you do a lecture for us, 10-15 minutes, because I have a lot of questions. Even from the phone yesterday, now I don't ask you. So let's just allow you do a 15 minutes, 10-minute lecture for us while we open the phone lines and we begin to ask those things that are not clear to us.
Thank you very much. So we are looking at COVID-19 vaccine updates today, this morning. Let me say this. Let me start by saying that the picture of COVID has kept on changing from what it was at the beginning. Now we have variants of concern. The vaccine that was originally intended to capture the original version of COVID that came out first is no longer what we are battling with today. And today we have a number of variants of concern. Suffice also to point out that newer ones may emerge along the line. If urgent measures are not taken, and what are these urgent measures? For us to intensify the vaccine campaign, for a lot of individuals, for countries of the world, for people to come up and get vaccinated. That is the only way we can break the chain of transmission of COVID-19. It's still causing havoc in a number of countries of the world. In the last 24 hours, about 2,004 persons died in the US.
That's very recent, sir.
Yes, in the last 24 hours. It's amazing that it is still killing this number of people even at this time. Okay? Now, but what can we do? What is the way forward? As it stands now, vaccine appears to be the major tool that we have on our hands.
Or should we call it a remedy, sir?
Yes, that can make a difference. Anything you call it, you may not be far from the truth. Okay, so that is why we must endeavor to get vaccinated whenever it is our turn. I do say this because I know that a lot of people who want to get vaccinated in a number of countries may not have the opportunity to do so. But those of us who do, please endeavor that you get vaccinated, and of course, you ensure that your loved ones, all the people around you, get vaccinated as well. When we do this, we are not only going to protect ourselves, we are going to protect ourselves, protect our children that are under the age of 12, who currently are not eligible for any form of vaccination. Talking about with the vaccines that we have, the ones that have gotten EUA, the ones that have been approved by the WHO, all of them are capable of preventing us from having the infection. Now the disease is also causing havoc even among our children. So you can imagine a situation where the children who are not eligible gets exposed. Okay, so that is why it's important that as parents, we should present ourselves to receive this vaccination. As teachers in schools, as people who come in contact with children all the time, we need to do that, okay? And I know that a lot of people have a lot of questions about the vaccine, and I can tell you that a whole lot has changed in the last few years with respect to COVID-19 vaccine. Initially, when the vaccine came out, we thought it was going to prevent anybody who takes it from getting infected at all. But that is not the picture that we have at the moment, in that people who are fully vaccinated can still have what is referred to as breakthrough infections. But the Center for Disease and Control in the US has come to say that, yes, they may be rare, but it could be about 0.005% of people or population or people who get vaccinated that may still end up picking up the disease. Do not also forget that at the time these vaccines, trials were done for these vaccines, the best of them, if I can use that word in quote, that had higher efficacy rates came as high as 93 to 95. Okay. So if you have a vaccine that averages along the efficacy rate of 90%, what that means is that if you immunize or vaccinate 100 individuals, 10 out of these 100 individuals, regardless of being fully vaccinated, can still pick up the infection. So no vaccine is 100% efficient. Not just for COVID, for a number of other vaccines. It is no longer news that these vaccines were hurriedly made. But I will tell you, that is one of the reasons why a number of people are
an emergency period.
Yes, a bit hesitant in coming forward to take the vaccine. But I'm here to clear such doubts. The truth of the matter is that the dominant vaccines, talking about the messenger RNA vaccine types, of course, when you mention this, you should be talking about AstraZeneca. You should be talking about Pfizer-BioNTech, not AstraZeneca, beg your pardon, Pfizer-BioNTech and Moderna. These are the two known prominent messenger RNA vaccines that were invented. Let me also say that messenger RNA vaccine production or development has been in place for many years, long before COVID came. Okay, so they already had a platform, a skeleton, if you like, at the time COVID came. So that was why it was easier for them to fill up the flesh, to add the finishing touches, and they were able to come up with vaccine in a record time. And today we are no longer talking about getting first and second doses. We are now talking about getting a booster dose. Just yesterday, the CDC Director General in the US, as we call it in Nigeria, Dr. Walensky actually said that Americans can start coming forward for the third dose of COVID-19 vaccines. But this third booster dose are not to be given to all individuals, okay? They are to be given to a certain group of people in the population. The vulnerable groups in the population, people who are elderly, people who may have people who may be immunocompromised, okay, whose immunity status may not be optimal or may not be robust enough. These are the individuals that can come up for this vaccination. They also warned that these vaccinations are not supposed to be mixed, meaning that if you were injected or if you were vaccinated with Moderna, for example, you can't come up to have Pfizer-BioNTech third dose. Okay, so for now, it is only available for individuals, recipients, people who were vaccinated with the Pfizer-BioNTech vaccine. Being the first. That was, of course, that first got emergency use approval before finally being approved. Okay, so for now, other individuals who got vaccinated with Moderna, as well as AstraZeneca and the rest of them, there is presently no booster dose for such individuals. So we need to exercise a little bit of patience. I do know also that Moderna has submitted their data seeking for approval. They've gone for approval for their
booster dose.
Yes, for their third shot, which is, of course, is the booster dose. Now, why was this booster dose necessary in the first instance? It has been discovered, the scientific community has discovered that 7-8 months down the line, a whole lot of people who got vaccinated, the immunity that their system built up over time has started to go down. Has started to wane, has started to go down. So there is need to have a booster dose. And these challenges were found more in people who were immunocompromised.
Okay.
These are people who have one form of illnesses or the other, people who have diseases like cancer, or people who are on certain types of drugs, cancer drugs, or people who have undergone organ transplantation, that on a number of drugs that are addressed as immunosuppressants, or people who have some form of blood cancer, leukemia, acute myeloid leukemia, and acute lymphoblastic leukemia, and what have you. Now, those individuals are the ones who should come up. Even people who have HIV/AIDS,
sure,
whether detected or advanced, okay? These are the people who will benefit with the third dose, as well as people who are exposed by virtue of their profession, talking about medical doctors.
Frontliners.
Frontline health workers. As it stands now, a number of nations of the world have done very well in immunizing their population. And I dare say that one of the countries that is topping the list of nations that have made progress in fully vaccinating majority of people in their population is not a country you can actually guess right.
Maybe US.
Unfortunately, it's not.
Britain?
Portugal. Okay, so Portugal has been able to vaccinate their people. They've achieved
Portugal.
84.2%.
South America.
See Ronaldo's country. At least you can remember that one.
Yes, now. But Portugal is Portugal that medically in tune.
Oh, here we are. So okay, so they are topping the chart. They vaccinated 84.2% of people in their population.
84.2%.
Okay, so next to them is UAE, United Arab Emirates. They vaccinated 80.8% of their population.
Dubai?
And after that, you have Singapore and Spain. These two countries have vaccinated 77.2% of the people in their population. And of course, the fourth is Chile. Chile has been able to vaccinate more than 73% of people in their population.
Still in the continent of America.
Yeah. So before you now start talking about other countries, okay, so it is important that we should go forward and present ourselves for this vaccine. I do know that there are a lot of unscientific notions out there concerning the vaccine. I've read about them. I've come across a number of them. Some say that males who get vaccinated may not be able to father a child and all whatnot. But all of these do not have scientific backings.
It's a moment for question and answer, and we'll open our phone lines. Please feel free to call in. And not only that, we said we get some question here we won't ask Dr. Barth. So please, once you call in, tune down the volume on your TV set so that we go there enjoy ourselves. Now, Dr. Barth, let me start this way because I would like to demystify or to clarify. Say the way people they see this first jab, that's the first dose. You will be doctor if you know talk for your ear. But we dey outside to carry everything, can't give you, so that you go as journalists. Now we dey for nook and cranny. That's about. Some people go talk say this first jab where we don't take. Go say one they go say no rubber. Say person rubber. If he cause I don't know, maybe you don't hear that. They say if no rubber. Say if you rubber, they say if he cause some strange illness. Well, I don't want to mention here. That's one. Now I want you to clarify. Is there anything like don't rub it after taking? Then number two, some people they talk say this thing if you take am, say if you meet malaria for your body, you are in trouble. You go sick for 3 days, you go sick for 4 days. Is it even something that helps to flush out malaria? Does it have anything to do with malaria? I've been all these things are just rumor. Then number three is at the last but not the least. If person is take am, what are the best measures one can stay or things that one can do? Should one stay away from alcohol within that first 3 days when you take am, or should one take a pain relief? Abi what are the things wey person fit do? Those are the first 3 questions I have for you, sir.
Thank you very much.
Starting from don't rub it.
Let me start from that one. Now, when you say, number one, I like to point out that it is healthcare givers, health professionals that should administer vaccines in the first instance. Okay, so we shouldn't allow anybody who is not a health professional to administer any vaccine or injection whatsoever to us. I do know as a clinician, I've come across a number of patients who developed the bad habit of injecting themselves.
Which is very bad.
Yes, injecting themselves with all sorts of injections. Okay, recently, I think some few days ago in my facility, I met a young man who should be in his early 30s. And he told me he has ulcer, and he felt the best way to go about it, that at a point he mixed glucose water and was withdrawing it and was injecting his tummy with the glucose water.
But that's abuse. That's a drug abuse.
Yes.
That's
Olaleko from Lagos.
Olaleko, good morning.
Good morning.
Good morning, sir. Dr. Barth is here, and we are also celebrating our 4th anniversary.
Yes, sir.
So join us on the show.
Good morning, sir.
Good morning, my
brother. Reduce the volume on your TV set.
Yes, sir.
Go ahead with your question.
Please, I want to confirm concerning the recent COVID-19 vaccine. It's low already. Hello?
Where with you?
Okay, I said the recent vaccine that is going on now, that is given to people, I learned that they said it might change or maneuver the genes of someone. Is it true?
That it can maneuver what?
That it can change someone's gene.
Okay. Thank you very much. Thank you for the question, Olaleko. It is not true that the vaccine can cause genetic changes on anyone that takes it. It is not that's an unproven and unscientific notion. It does not change anybody's gene. First of all, let me point out that maybe I should paint a picture of how vaccines are made. Okay, we have a number of versions, a number of types of vaccine. I must also point that out. But generally, they have something in common. Vaccines are made, some of them are made by having an attenuated form a suppressed form of the organism of the virus, okay, which cannot be harmful to the body,
Okay.
either taking them in whole or part of it and introducing into the human body. For instance, measles vaccine, okay, is life attenuated vaccine of that organism that causes measles that are injected. Now, when it gets into the human body, it elicits an immune response that will end up producing fighter jets that are capable of bombing any such infection that could trespass or that could come into the system in some years or some months to come. Okay, so that's like giving an analogy so that we can capture what it means. It could be a part of it that is taken. For messenger RNA, it is a genetic material that is taken and then introduced into the human body. That will cause a replication. That will cause a production of antibodies, an immune response, okay, that will position the body, keep the body ready to attack anytime it encounters similar infection. Okay, so that is the pattern. So it can't change your genetic makeup. It can't convert you from man to a woman.
To a woman.
Okay, so it does not have power. No vaccine has the power to do such. Thank you very much. Now, going back to the question that Chief asked,
yes,
whether we should rub. I was trying to give
maybe
an
we
example.
Should rub the
yes, and I pointed out,
taking.
and I warned also that people should not resort to taking injections of vaccines themselves. I was trying to give a story of a guy I came across some few days ago who told me he was injecting glucose inside his abdomen, into his tummy. Initially, I doubted him, but I had to ask him to
do it again.
No, move up his clothes. No, of course I can't do that. And when he moved up his clothes, truly there were marks,
needles,
30 signs of injection sites on his tummy. Precious,
yeah,
from Lagos.
Okay, good morning, Precious.
Good morning.
How are you doing?
I'm fine, thank you.
Precious, Dr. Barth is here. But first and foremost, let us wish ourselves a happy anniversary. Health Matta is 4 years today. So congratulations to you and us.
Thank you very much, Precious. We are glad to have you on.
So, Precious, let's have you.
Okay. I have a question to ask.
Go ahead.
I have a brother that took this vaccine. He was healthy enough before he took the vaccine because he must take it. He was mandated to take it. But for the past 3 weeks he took it, he has been having this serious acute headache. He has not been himself. And it has been so bad that he has been becoming scared. And this sickness was not there before the vaccine, but after the vaccine, after 2 days after the vaccine, he has not been himself up till now. So why? What is happening?
Thank you very much for that very important question. Thank you very much for that very important question. Now, let's leave our COVID vaccine out of this. Okay, so let's use something that is very common to us. When we take our children to receive some vaccines,
Ben,
it's a well-known fact that after receiving such vaccines, oftentimes those children will start having temperature.
Fever, high fever.
They will start having fever.
Ben.
Okay? And in such case, what you need to do as a good mother, as a good father, is to administer simple paracetamol in the house. And over a period of 1 or 2 days, the child will get better.
Syrup.
That is for other vaccines that have nothing to do with COVID vaccine. Okay? That said, we do know that some individuals may react to some form of vaccines. Not everybody. Okay, so people who have known allergies usually are advised to be exercise caution when it comes to taking some things, especially those ones that are known to them. But you must also point out that they may not be known to them before they can come forward. So people who have a history of severe allergies usually are asked to exercise caution. They need to be guided. Samuel from Lagos. We'll still come back to the question.
Okay, Samuel, good morning.
Good morning, sir.
How are you doing, sir?
We bless God. How are you?
We do okay. Happy anniversary to us.
I wish you the same, my brother.
Thank you
for
Samuel.
following up.
Yes,
Your question, please.
Please, I have a question for the Doctor.
Please go ahead.
Actually, I had some of the countries you mentioned that they have immunized majority of their citizens, kind of.
Yes.
And I start wondering, does these countries, are they producers of this vaccine, or do they get it from the same source other people are getting, and those people we are even getting it from, they have not succeeded in getting to that extent of immunizing their citizens? How
come they were
Good
able
question.
to do so?
Yes, how come they are able to
Achieve that.
Achieve that? Yes. Thank you very much.
Thank you very much. Very good question. Number one, it has to do with their population, how large or how small their populations are. Okay, we do know that that India and US are one of the most populous countries,
so after
countries in
China.
the whole world.
After China.
After China, okay, and it will be difficult for such people to immunize such numbers of people over a period of time. Eventually, they will all get there. But countries with smaller population, like Israel has been doing very well with respect to vaccination. As a matter of fact, the so-called third dose, booster dose, has been ongoing in Israel some few months ago, before US actually approved theirs on Friday. Okay, so Israel has started. The populations in Israel have started receiving the third booster dose of vaccines.
They have gone past the second jab.
They've gone past the second jab. Okay, so one of the reasons is because of their population. Number two, priorities, setting their priorities right. Okay, their government must have been on top of the situation.
I believe.
Not just because of their population, getting it right. Okay, so a whole lot. Policymakers will have to do their job the way it should be done.
The
okay,
level
so
of seriousness.
it could be traced to a number of reasons, but I'm sure one of them should be population, the size of their population, and of course, the degree of seriousness that the home countries or their leaders have actually shown, okay, with respect to this. Okay, so I'd like to quickly go back to the second question before yours came in. The lady who asked that she knew someone that had vaccine and up to 3 weeks, the person has not fully recovered. Number one, I agree with you. We have seen such, okay, such can happen. In some cases, it will even require hospitalization.
Ben.
And I can tell you that we have recorded cases of people who took vaccines. They were hell and hearty before going to take the vaccine, and at the end of the day, they got hospitalized, and some of them, unfortunately, did not survive.
Wow.
But that said, that number, it is a rare occurrence. It is so insignificant to compare with the large numbers of people that have taken the vaccine. So far, billions of vaccines have been administered across the globe, across several countries of the world. Okay, so it can happen. But when it happens, advise such a person to go and seek for medical attention. Doctors will be in a better position to know what to do in such scenario. But that shouldn't discourage everyone or any one of us from going forward to take the vaccine, because the gains by far outweigh the risk. In medicine, we usually talk about the gains, the benefits, okay, outweighing the risk of not taking. I can tell you that majority of the people who are hospitalized today in the US are largely people who were unvaccinated. Okay, so if you're vaccinated fully, if you end up having a breakthrough infection, you may not even know that you had one, because it may be so mild. You may not present with any known symptoms. It could be asymptomatic. In some cases, if you show symptoms, it may be mild, may not necessarily lead to hospitalization, and of course, death. So
because
that is important.
Because you have been fully vaccinated.
Because you have been fully vaccinated. So it's important to be fully vaccinated than not to be vaccinated. Sometime in July, okay, Anthony Fauci and all other experts were discussing about the possibility of approving of booster doses. At that time, they said they didn't have sufficient evidence, sufficient data. But less than 2 months down the line, the position has changed. The CDC has approved of it in the US, and that happened only yesterday. Okay, so any moment from now, the booster dose, the third shots will start getting into people's arms in the US. And one begins to wonder, what will happen to those of us in this part of the world that are still struggling to get the first dose, not to talk of the second one, because there is no equitable distribution of this, okay? But that said, in as much as we are still waiting to see when we can take a consignment that can go far in immunizing or vaccinating larger percentage of our population, we should not lose the sight of the fact that those preventive protocols are key, very important. Okay, so we must ensure, vaccinated or not, that we wear our face mask at all times.
At least.
Whenever we're in public places or spaces, we should have our face mask on.
Blessing, good morning.
Morning.
How are you there, Blessing? You need to speak up a bit.
Okay, good morning.
Yeah, good morning, Blessing.
Okay.
The doctor is here. Go ahead with your question.
I want to ask,
You need to try call us back, Blessing. You need to try
Thank you very much. Okay, so apart from wearing our face mask, we also need to ensure those other preventive protocols, okay, that we have been tutored about, we have been told about at all times. We must ensure that we wash our hands with soap and water under running water. Where that is not possible, we must use our hand rub or hand sanitizers at all times. Avoid crowded places for now, because I can tell you that the so-called Delta variant, those variants of concern, prominent of them all is the Delta variant. Okay, now it's more transmissible than the previous variants that we have seen before. Apart from that, the antibodies that we have in our systems for people who have been previously infected, people who were immunized, or who has had the COVID vaccinations, it resists the antibody. So it does two things. It can resist the antibodies in our system, and that enables it to evade the body's defense system or defense mechanism. And that is why more and more people are getting infected. Okay? It is a well-known fact now that it is more contagious than all other variants that we have seen before. Do not forget that we have 4 variants of concern in the world today. Okay? Those 4 variants of concern, some of them started in a number of countries. Now, the first one, the Alpha variant, started in the UK and Kent. Okay? That the scientific name for that one is B117. The second one, the Beta variant, started in South Africa, emanated from South Africa. The scientific name for that is B1351. There was also another one of concern that emanated from Brazil. The scientific name is P1, and of course the WHO name is Gamma variant. Okay, scientific name P1. And the last of them all appears to be the one that is given the world the biggest of challenges.
And that's the Delta variant.
That's the Delta variant that emanated from India. The scientific name is B1617.2. Okay, and that is the one that is responsible for 80 to 90% of all infections in the US. Somebody asked earlier today that these countries that make these vaccines, how come they are not topping the chart in terms of vaccinating their population? One of the things that I forgot to add is that even among those countries of the world that have made these vaccines, the vaccine hesitancy is more prominent in some of these countries of the world. People are refusing to come forward to get vaccinated.
Despite their level of exposure.
And the experience has shown that majority of people who come down with severe disease were at least opening up to the physicians, to the doctors who were treating them. If only I had known. What stopped me from taking this vaccine? Why didn't I take it? But by then it probably was too late for them. And a good number of them have actually lost their lives. Suffice to say that a whole lot of people have died as a result of this nonchalant attitude, if you like. At the moment, globally, COVID-19 has affected more than 231 million people. And it has caused over 4.7 million deaths across the globe. Suffice also to point out that 208 million people, more than 208 million people have actually survived that were infected. Those ones that have survived, we still need to take the vaccines. They also need to go for the vaccines, depending on what country of the world that you are.
Okay. Dr. Barth, that was a very deep one. We say a very big thank you for the insightful one you carry us go on top COVID-19 today and the vaccine update. But at this junction, Dr. Barth, I think it's good we do a cake cutting celebration because 4 years no be beans. And like we take talk yesterday, pikin wey dey born 4 years ago, he go don register am for school by now. So therefore, so we are doing fine, we are doing well.
Let me ask you for a favor.
Okay, sir.
Those are 3 questions. Let me use 1 minute to address them.
Okay,
because
sir.
I'm sure a lot of people who saw the question will want to have an answer.
Okay.
One of the questions he asked, we couldn't take them because other questions were coming in. Is it good that oftentimes they will ask you not to rub the injection site? Okay? If you're asked not to rub the injection site, please do not do so. Some injections are not meant to be rubbed. Some injection sites are not meant to be rubbed. And most of them are vaccines. So usually when you're giving you may be told, please do not rub it. Just obey them. They are health experts. They know best. And then the second one, when somebody has malaria, I want to address it because it is common in our environment. Somebody that has malaria and goes for the vaccine, will it make the malaria worse off? Malaria is not regarded as an underlying illness. When we talk about having an underlying illness, we are looking at diseases like hypertension, diabetes, asthma, when they are not controlled. The truth of the matter is that those of us who have been in this in the tropical environment for long, we don't fall sick for malaria because we're already exposed to them. So that shouldn't be a reason why any of us shouldn't go should avoid going for the vaccine. Okay, so it won't stop you, and it will also not make you worse. And then the last one is what to do. Oftentimes people say we should take paracetamol. I've heard that before going for the vaccine. It is not recommended. Please do not do that. But after the vaccine, if you have headache and you have fever, you can at least take paracetamol. Okay? That is trying to do justice to your question.
Thank you so very much, sir. Doctor, if our hands are not too busy, maybe we should just straightforward. While viewers at home too will join us. Together, I think we can spell Health Matta.
Yes,
H-E-A-L-T-H. What of the matter? M-A-T-T. Hey, Health Matta. Thank you very much. Thank you. More years to us.
Thank you very much.
Thank you to you, Dr. Barth.
I appreciate it.
God will continue to strengthen you.
Thank you very much. Thank you, WAP TV, for giving us the platform. We appreciate you and our numerous viewers at home and around the world. Thumbs up to you.
Thank you.